Welcome to our Caregiver session on child mental health. During this session, we will cover the importance of fostering positive mental health at an early age, co-regulation and strategies, making transitions easier, supporting infant mental health, recognizing emotions, emotional regulation, and resources.
First, it's important to understand why fostering positive mental health at an early age is beneficial. Providing your child with a safe, caring, and nurturing environment can promote resiliency throughout their life. Encouraging positive mental health can also aid in a child's social and emotional development, and it can improve a child's ability to have positive relationships with others, as well as have a positive relationship with themselves. Now we're just going to go through some different concepts and strategies that may help to foster positive mental health at an early age. First, we're going to talk about why children have tantrums. Just like we can become stressed, children can be stressed as well, and when they often have tantrums. But tantrums are a normal part of childhood. A tantrum is a way for a child to communicate, and if they start having one, it's a response to something. This could be something that's overwhelming, overstimulating, frustrating, confusing, or uncomfortable to them. Instead of dismissing or punishing a tantrum, it's important to try and understand why your child is having a tantrum in the first place, because there's always a reason behind a behavior. One way to do this is by using co-regulation. Co-regulation is a way for you as caregivers to help your child manage their immediate emotions, and it focuses on the way that you interact with your child when they're experiencing those intense feelings. This is why caregiver mental health is so important, because you need to be able to be in tune with yourself and your body cues to be able to help others. You can't expect your child to feel calm if you don't feel calm yourself. If a pilot went over the intercom during turbulence and started yelling and telling everyone to be calm, I'm sure that we would do the complete opposite and start panicking. But what if the pilot said, "We are experiencing turbulence. I know this can be scary. I've flown through lots of turbulence before, and I will make sure to do my best to get you through this as safely as possible." The difference is in the way we communicate. Using co-regulation can help your child to grow emotionally and socially, and over time they can learn how to calm their emotions on their own. There are several components to co-regulation, but the overall goal is to de-escalate your child's intense emotions. It's important that you focus on the emotions that are causing their behavior. For instance, if a child is playing but their sibling is using the toy they want, the child may show a behavior of hitting their sibling. But the emotion stems from frustration and anger. Modifying the environment can be helpful if it's overstimulating or overwhelming for your child. Intense environments can often intensify their emotions. It's also important that you present yourself in a way that's calming and soothing. Your facial expressions, tone of voice, and body posture can all be used to communicate a safe presence. One of the most important things is to acknowledge and validate your child's emotions. For example, if we go back to our situation where the child hits their sibling, you could say, "I can see that you're very upset. Your fists are tight, you tried to hit your sibling, and I can see that you're tired." Labeling their emotions and body cues can help them understand how they're feeling. Another part of co-regulation is to be patient. Your child may not be receptive right away, and they may need time before they're ready to address the situation. It's also important to model self-calming strategies with your child. For instance, you may do calming breathing exercises with them to help regulate their body, and we'll post some resources to different types of calming strategies on our website. When they are feeling regulated, you can work with them to come up with solutions for that situation. Using our same example with the child hitting their sibling, instead of telling them, "Don't do that," work with them through how they're feeling and what they can do next time. You could say something like, "I know you're feeling mad right now, but when you hit, it makes other people feel sad. If you feel like hitting, try our bubble breathing. Then you can take turns with the toy." Overall, co-regulation can enable you and your child to work through intense emotions and can be beneficial for their mental well-being. Another way to foster positive mental well-being is by making transitions easier for your child. And by transition, I mean any time where there's a shift in what's being done. So this could be getting out of bed, having to stop playing, getting dressed, coming to the dinner table, bedtime, and that's just to name a few. Transitions can be hard for children and can trigger challenging behaviors such as tantrums, yelling, whining, and crying. As we've mentioned, challenging behaviors always have a reason behind it. Oftentimes, a child just isn't ready to move on, so they communicate their unpleasant feelings through challenging behavior. But there are some strategies that can be used to make transitions a bit smoother. One strategy is creating a routine which will make the activities you do every day more predictable. This can be combined with the next strategy, which are visual cues. If your routine may change from day to day, you can use something like a visual calendar. It has pictures of activities to show your child what's happening next. Another way to ease transitions is to give your child a time warning. Let them know that we're getting in the car soon, you have 10 minutes. After you tell them how long they have, continue to check in, giving them more time warnings as you get closer to the transition. So maybe a 5-minute time warning and a 2-minute time warning. Transition songs and activities can be a fun way for your child to be aware of what's happening next. An example of this would be the cleanup song from Barney. By playing the song, your child knows that it's time to finish what they're doing and clean up. It's important that whenever your child transitions smoothly, that you praise them for it and let them know what a good transition means. For instance, you could say, "I really liked how you cleaned up your toys right away and started brushing your teeth. Now we have more time to read a story."
Infants are essentially guided by emotions pre-wired into their brain. For instance, cries are usually an attempt to avoid something unpleasant. Within the first 6 months, infants are capable of experiencing and responding to distress by adopting self-soothing behaviors such as sucking. For caregivers to support their infants' mental health and general development, it is important to form a secure attachment relationship with them. Attachment can be defined as an enduring emotional bond characterized by tendency to seek and maintain closeness to a specific figure, particularly during stressful situations. Secure attachments lead to positive infant well-being and lay a good foundation for being able to form other secure relationships, to seek support when needed, and to draw strengths from the support which is given in the future. In order to promote a secure attachment relationship with your infant, you should be reliably available and responsive to their needs. This often can be done through simple day-to-day actions that you normally do without thinking, such as talking to your baby, responding to their cries or smiles, and comforting them when they're upset. When your baby is upset, think of the 5 S's by Dr. Karp when trying to comfort them. The first S is swaddle. Swaddling replicates the snug sensation of the womb and is key in calming. The second S is stomach or side. While the back is the only safe position for sleeping, it is the worst position for calming. Holding your infant on their side or stomach can help to calm them. The next S is shush. A shushing sound, again, is reminiscent of the womb and can help to calm your infant. The second last S is swing. While supporting your infant's head and neck, gently swing them to replicate the movement of inside the womb. And lastly, the last S is suck. Utilize a pacifier to calm your infant. All of these actions can help to form a secure attachment relationship with your infant, in turn supporting their mental health, development, and overall well-being. As your child grows out of the infancy stage, they begin to understand that certain emotions are associated with certain situations. It is important to talk to your child about emotions and encourage them to name emotions when they recognize them. All of our interactive sessions and additional resources this week include activities that will allow your child to practice recognizing and naming emotions. It is important to teach children that emotions are normal reactions. It is okay to feel angry or frustrated. Emotional regulation is the way we deal with these big emotions. By the time your child turns 2, they are able to adopt strategies to deal with difficult emotions. For example, they are able to distance themselves from things that upset them. Again, our interactive sessions and additional resources this week will provide activities that will allow your child to practice various strategies for dealing with big emotions. Strategies for emotional regulation often focus on these concepts: situation selection, situation modification, attentional deployment, cognitive change, and response modulation. Situation selection refers to when a conscious decision is made to avoid emotion-inducing situations. Situation modification involves making a change to a situation that may otherwise be emotion-inducing. For example, plugging in a nightlight if your child is afraid of the dark. Attentional deployment is the ability to draw attention away from emotion-inducing situations. Cognitive change refers to the ability to change how we see a situation, and response modulation means that we directly influence our response systems. Thank you for taking the time to listen to our child mental health informational session. We hope that you found it helpful and that our interactive sessions supplement what you have learned today. If you are looking for more information regarding child mental health, this slide highlights many resources that are available.